hospitals trying to get.
Okay, sorry about that, technical difficulties. We left off with the resolution 2026-7, Granite County resolution requesting the Montana Association of Counties advocate for the improvement of Montana's civil and voluntary mental health commitment process, first reading.
This is Blaine, let me give a little background on it.
Sure.
So, been a lot of issues with the state hospital at Warm Springs with basically a backlog of bed dates. I think it's basically an employee issue, not it's getting employees is the issue. But state legislature is working on it. They're actually going to be working on a facility to be built in eastern Montana. So I have a state mental hospital east. And then also Mako has some ideas on improving the system, making it more efficient for basically getting someone help right away. The current process, the county attorneys have to file a petition. That takes some time and it's inefficient. So their idea is to have a mental health professional be able to sign a letter stating that a 72-hour hold is needed. And that's what that's what this resolution is for, whether the county commission wants to be in support of that or not. And then there are other tweaks that could be made in the law. And so the resolution encourages Mako to look at all aspects of improving the law.
You want to thank you for your background.
Yeah, that makes sense.
Yeah.
Yeah, I've heard a lot of mental health going on this away, they're gonna be and
They do
Okay.
have traveling nurses over there, but yeah, I think they have the money. It's just, yeah, I don't know.
Discussion done.
Mm-hmm.
Okay, let's move on to the canvas for the.
Or public comment. Did you take public comment?
she just asked if there was.
What was the first reading? Is there any public comment on the first reading for resolution 2026-7? Thanks, none. We'll move on to our next agenda item, which is the canvas for the primary election. And what has happened is Paul Pulaski, Commissioner Pulaski will not be here. And so we need to appoint another person to be on our canvas. And with that, we'll appoint Blaine Bradshaw. Do I have a motion to appoint?
I make a motion that point blank.
I will second that motion. Is there any public comment on our appointee? Okay, being none, here's Sarah Ram, our administrator, our election administrator, who
Hi.
canvassed the primary.
All right. So of the 2,750 registered voters that we have, there were 1,291 that did vote. So we have the abstract of votes here from our system that we placed up. So there's the 2750 and then the 19. No, I'm just saying, because this is the place that you're gonna start on. You're gonna start on.
Why the hell are you giving me that?
Because I'm giving you that so that everybody has something. So I have the detailed results also that came straight out of our DS 450, which is the machine that counts our ballots for us. And then I have the sheet that, the tally sheet that we use, that we put out on the board, that we had transcribed everything. So I think that I'm gonna have, Blanche read off, and we're just doing the totals. So you'll see totals on this side. And
Okay,
we've got the
so
totals on the bottom.
what we're going to do is the Democrat side first.
Well, it actually, we're gonna go through, it's gonna be Democrat, Libertarian, or Democrat, how does this one go? Democrat, Republican, Libertarian. So that's what I've done, the 1,
By race.
2, yeah, by race, 2, 3, that's how this thing is. Yeah, so that's why, so on this one, it has just the Democrat and then all the Libertarian and then all the Republican, but all the other sheets go by race. So if we just do 1, 2, 3, 4, it'll follow along with the other sheets. Okay.
So
You're kind of confused.
for
Do you want
US,
that one?
US,
Yeah, birth.
Yeah. okay. US Senator Alani Bankhead or Laney?
Laney.
Miss Bankhead.
Okay, 108.
That's what I,
So check. You see 108? Okay. No, don't touch that one.
I can print out another one, it's fine.
Michael Blackwolf, 50.
check,
Michael Humbert, 8.
check,
Christopher Kehoe, 28.
check,
Riley Neal, 81.
Yep.
Okay, so Kurt Almy, 666.
check,
Lee Calhoun, 141.
Yep.
Charles Walkenchild, 105.
yeah, check,
Okay, and Kyle Austin, 1.
check,
And Tom Jandron, 3.
check,
Okay, so US Representative Ryan Busey, 109.
Okay.
Russell Cleveland, 44.
Okay.
Sam Forstag, 96.
Okay.
Matt Raines, 29.
Yep.
Ray Curtis, 52.
Okay.
Aaron Flint, 481.
Okay.
Christy Jacobson, 295.
Okay.
And Doc Olszewski.
Oh, Dusty.
What is it?
just,
Oh, is that?
117.
check,
Okay, so they're moving on
oh,
to
there's Nick Sheedy,
So there's
5.
the libertarian.
5 and then 6.
Yep, I was getting you
Oh,
there.
I was getting, you have it on a different page.
Yeah, they're all,
Yeah,
Oh,
I have to go.
she has to go back and forth. I numbered them.
And Nick Sheedy 4.
Yeah, check,
Okay, so onward to Public Service Commissioner, District 5. Kevin Ham, 235.
check,
Annie Volkacek,
look at check,
216.
check,
Joe Dooling, 284. Dave Sanders, 288.
check,
And Supreme Court Justice
Yours.
4.
He's good.
Amy Eddy, 495.
check,
Dan Wilson, 600.
check,
State Representative, District 76, John Fitzpatrick, 336.
check,
And Trish, 634, Schreiber.
36.
that's just three.
636, sorry. I don't know how I got 634 out of that. 636, so I have two.
That's good. That's what.
So, Commissioner District 1, Dave Kessler the third, 356.
Check,
Blanche McClure the first, no. 375.
check,
Stephanie White, 228.
check,
Okay, so, well. Oh. And Elena Gagliano, 3.
check,
Okay, so now we're going to local option motor vehicle tax. Yes, 774,
Check.
no, 491.
Good.
And Peaburg Area Library District mill levy. Yes, 486, no, 334.
Check.
That's it.
That's it.
That was easy.
Yeah. Okay, so I think we just need to stamp that one so we can, and then. Then I have you guys sign.
Yeah.
And,
Motion to, well, like a motion to approve.
I'll make a motion. I'd entertain a motion to approve the canvas of the primary elections.
Second.
She's entertaining the motion.
Oh,
I'll make the motion to approve the canvas for the primary 2026 election.
Second.
Any public comment? All in favor?
Aye.
Aye. Motion carried and passed. Good job.
thank you, yeah, it went
Administrator.
it went really well. Except for we have trouble. With getting,
Okay, do you
judges.
need stuff? There's one little thing that I stamped that needs initialed by Blaine. The official,
I didn't touch.
I think Blaine has it.
oh, you got it.
My initial for a piece of.
Okay,
Okay.
all right,
Perfect.
great job.
Thank you.
Thanks.
Okay. All right. Get out of here. Thank you. Thanks, Blaine.
You're welcome.
That was a good system, Miss Election Administrator. Okay, so. County claims,
Wait a minute, could I call Diorama for
Yeah.
John, please?
so we've got a few minutes before she brings it in. Yep.
Look out back or.
Oh, yeah, give it to
Sorry.
her.
I'll be back at 11:10.
Okay. Thank you, Blaine.
You're welcome. Good job.
Whatever number John gave me isn't the right one.
For where?
Diorama, but see, there's like 2 or 3 of them.
Who's what?
I'm sure it'd be maybe I better call John. That 0, or let's see, 288-1000.
John is 288-0005.
All saying that cow guard's full, we'll have to take, get somebody out there to take care of it. I think the crew will have to, maybe they could use the water off the back of the water truck and spray it out for now until we get through it. So Kyle Graney's cows don't get it. It looks like we bladed it in.
So who would have done that?
Just some, when they're blading and snow plowing, they could have pushed it all in.
So it's probably been like that.
Looks like it's been for, at least since last year. He sent a picture. Did you get anything from me?
No, I'm disregarded here.
Is Middle Fork your road?
Either.
See, and glass. See how it's to the shoved in, see the cattle garden, you see the dirt on both sides, it just got shoved in. When
There,
there's no
so you think they could center right there and know right there, okay, we can cross here.
Yeah, cows will just, I think a guy could probably take the water truck out there and spray it out for now, just open it up, and then we'll have to pull it, clean it. All pile green,
So where's it at?
Middle Park. Hey Kyle, this is Scott. Hey, do you think they could spray that out to keep the cows out there, or we're gonna pull it right away? It's a packed in there. Okay, well, we'll have to try to get somebody up there and pull it then right away and clean it. I was worried about it being packed in there, but I thought I'd call and ask you. Paul's home.
Let's stamp out the pages.
Put it on.
Let's stamp all the pages. Just so that, to do one, you always stamp all pages.
Mine, I should like.
Oops. Might as well. Overkill. Yeah.
Needing ink.
Yeah. Yeah. Okay. Oh.
Have him bring it in if you want. You need
Okay.
to get it.
Yeah, is Blaine will be back. Yeah. Yep. And he doesn't need to sign it for PK, cause he's the person.
Right.
Cause I saw you did that, and I was like, then don't even do that. You're the important one today. Yep. Alrighty, thank
Yeah,
you.
you were disappointed.
Right. Thank you.
See if she has plans. Do you want me to go?
Yeah, we can't blow it out, are we on?
Yeah,
Anyway, we'll have to pull that, caliber and clean it, it's packed in there.
more pages. Every one of them, you need,
I signed up.
and then there's another one after that one.
Oh.
She needs all the pages stamped, I only stamped one. Just brought back in.
I don't know.
Oh,
Do you know?
code. Here. She doesn't have
Should have a,
She's on the phone,
Oh,
so. Sorry.
do I take these back to Sarah?
Yeah.
well, Blaine needs to sign too. Okay, so we are right now doing county claims. And I guess we'll get our. Oops. Oh, that's you.
Hey, John Scott, say what's that number, the one you gave me's disconnected? Or I might have heard you wrong. 4331, and it's Ryan, and that's the one out on Broadway? Yep, I will get a hold of Adam. All right, bye. Adam, this is Scott Adler. How are you today? Hey, I was calling to get something, the solid waste guy says it can't get them tires done. On the backhoe for the foam. Do you know when it might be? Oh, yeah. Today's 16th, yeah, we're gonna, ooh, is there anywhere else we can get that done? I mean, if we don't compact them, we lose so much money. Okay, I guess we'll have to figure something out here. Yeah, if that's not gonna be. If he comes in, well, he could put the front ones on, we can get by for right now until you get it in, right? Huh. Well, yeah, better have her tires on it, it's got. Oh, no, we don't have nothing on it, then we took them all down through your ones. Might have to send him down and get them until you can get that in. Just run it without a phone till we can. Maybe if we could tube it, just get them so we can use them, otherwise we. Okay. Well, yeah, that ain't what he told us. All right, Adam, I'll come. Well, there ain't no reason to get all pissy at you. I mean, we can't. I mean, that's only for me to do, Adam. But no, I'll call him down, take the trailer down, get him, put him back on until we can get the phone in. Might have to make an extra trip, you know, make us a better deal on the phone. All right, buddy. He said John was an asshole. He said John was an
What
asshole.
did he do?
Got all pissy with him. He said he would have put a tube in, he could have took them both of them back tires back with him, and just used it as the way we've been using it. He said, no, wait, well, I ain't gonna get the phone till 22nd. So he can go back down, get the damn tires, put them back on until they get the phone.
Yeah.
If he don't like it.
And he knew this, he was told this,
Adam, so,
so he's just totally lying.
no, John. That Adam, I know it's. So we'll just have to, yeah, we'll just have to get them put back on. We'll just send them down, he'll have to go back down no matter what, and get them, put them back on. I hate that thing. So. Call down and have them go get them and put them back on.
So what is the tires down there and then they bring the tires back and put them back on? So right now it's sitting at the,
Without time.
without tires.
Hey, John Scott, yeah, I talked to Adam, he said they'll throw a tube in there and they won't have foam and nobody else in town even has it. That they get the foam not till 22nd or even the next day, so we might wanna just go get tires, put them back on, and run them the way they are till it gets the foam. We don't have nothing else we can take up there. He said he mentioned that to the other, he said you wanted to wait. Oh, go to Bearing to get the phones? Oh, he never said nothing, but. No. Yeah, I don't know nothing about that, but he said they throw that tube in and just call them before you head that way. We'll just have to throw them back on, John, and get by until they get the phone. I know, John, but there ain't nothing I can do about it. We don't have nothing else. No, and I think you did too, a good job. I don't get stopped that Rick was gonna come up and look at them, never got time, so. Yep, he told me that, and we'll just have to throw the bathrooms on and get some help with them on so they don't get hurt or nothing. We'll, okay. All right, John, yeah, just make sure you call them down when you're headed that way to get them, or if you got somebody that wants to run down, we'll compensate them to get them, or I don't have time, I'm still commissioner. Okay. Let me call Sam and see if anybody from the road crew, oh, they're busy, they never mind. Can't do that either. Nope, I can't pull nobody from there. Alright. Oh, sounds good, John, appreciate it, thanks. Bye. Yeah, go get them in the morning and put the tires back on. If we get it flat, we do, I don't know what else we're gonna do, we don't have nothing else we can really take up there to, until the 22nd or 23rd is when the phone will be in, and we'll take them back down and pull them.
Is she putting tubes in them then until? They'll have them ready for him?
Yeah, I'm ready, I said, make sure he calls before he heads down, so they're ready, but Adam said they'll have it ready. Did we get a copy of the?
No, we don't, but might be off the phone if you wanna go ask her.
Is our deductible then on that car was 2,000 and it was a city dump or city plow that hit it?
Yep,
So do we send this to them?
they've already paid.
Oh, they did?
Yeah, they paid.
Right.
Yep.
How are you? How are you?
I,
What you been up to?
Oh. We keep those ahead of things.
How's that going?
I have the. It's tough.
Mhm.
I have been working with the hospital board, which is actually why I'm here today, so.
No? This fly service stuff, they just putting up stuff to get rid of the flies or they spraying?
I'm not sure, that'd be
Dawn?
Dawn, yeah, something with Dawn.
No. I guess.
what's the coroner's inquest?
A whole bunch of them. Can't say. See, we spent 9,000 or 18,000 on totes of Mega Ready. We're probably gonna have to get some more. Guess I'll go ahead and tell them go to fifth and just maintenance. Maybe. Maybe next time, if we have to get that for them equipment, we might see about ordering some, save like $4 a thing. A can, or 2.5 gallons,
Yeah,
or get a case from Walmart or somewhere, cause they're $12.19 at Bickler's and I want to shop around.
Yeah.
If it says it's quite a bit, we get a case of it.
There's the reports.
thank you.
Thanks, very good.
Huh?
Will you have Jeremy call me and, no, I still want, we're still interested in that certification stuff, so we gotta figure out when we can do it. After today, we'll figure out which one, so then we can make a plan. I kinda dropped the ball, I was supposed to get back with you.
I know that he just held a 24-hour course 2 weeks ago, so, yeah, I mean, reach out. Yeah, I mean,
No, I did, I kinda thought, you know.
that's fine, yeah, he's got the coursework, he's got it all ready to go, so,
Okay,
I will have him.
well, after today, then we'll find out, and we can set up, and get that. Okay.
Okay. Yeah, well, I get, maybe chat with your guys or between you guys and figure out when would work or how you want it to work. If it's gonna be, if you can afford to have everybody at the same time go. Or if you have
Yeah.
one shop go and then another shop go, figure
Right.
that out and then he can,
I have to split them just so we
Yeah.
have people out.
yeah. So that, just kind of figure that out and then he can.
And this
get you
is
your-
for what?
So they gotta have me, so when they're hauling out these gravel pits, they're supposed to be light or certified.
M shop.
Oh, yeah.
Any part of the mining portion of it, they need to be certified for. And because we have our own county mine, gravel pits,
Pit.
we have to, they have to be certified to be on site of those pits.
Okay,
And anytime that they're going on and off other people's pits, like when they get gravel from Doug or Phil, they're considered part of the mining process. And so they have to be MSHA certified to do that. We could get in big trouble if they're not.
so can they do that online?
No, we have to have somebody train it. Oh,
I
you
know, can't you
mean,
do it online? Training online? Brand shop?
have him train them online or what do you mean?
I
I was
know,
just gonna say, cause he's certified to do it and then
Who
he
is?
is. Jeremy Hickey.
oh, okay,
And
okay, I get it.
After reading on it, Matt, it's holy,
So he had a refresher course and that's how I heard about it, because I was setting up the food and stuff for his refresher. And he was explaining who all was supposed to, and I was like,
I think it'd
we
be better
have
to have
our
it in.
own mind.
Oh, I would just think, I didn't know that you had someone here to do it.
Oh,
I was just thinking, cause David
I
had
was
to
gonna bring it
do
in.
online one.
I was gonna
Yeah.
have it on Road and Bridge when they
Yeah,
find out, and then we talk about it, but I just wanna make sure he calls up, we're still capable of doing it.
could they do it like on a day off? And they
Well,
can
it's a-
pay for it?
it's a 24-hour course.
Oh,
To start, you have to have the full MSHA, it's not the refresher course, the refresher is. Like 8-hour refresher is what the refresher is, and you've gotta have that every year or 2 years or something, I'm not sure, but. Initially, you have to have the 24-hour full course,
and we haven't done that, have we?
ever. Mm-mm.
Yeah, we need to do that.
If you read it up, cause it was brought to my attention, and then I started reading it one night, there's a whole, but we can do the one course is either 46 or 48, we'll do anyway, you gotta read through it, and we can get by going through the one instead of the big ones.
Mhm.
I did read on it.
Yeah, oh, yeah,
So,
What's this?
unless they're. Atterberg limits, which would be like the. Liquid, plastic, plasticity.
I guess, how much.
Oh, this that gravel place?
Yeah.
I thought, I didn't know they were called HMH, I'm like.
Yeah, okay, yeah,
Alright, thanks.
yeah.
I'm sorry, I have squirrels
That's
everywhere.
okay.
So then what we need to do is just set up everyone, where we can maybe do two at a time, maybe, or?
You know, that's why I say if you guys can figure out if you wanna do like haul shop all at once and spread those guys throughout and then do the Peaburg shop all at once, or however you guys need to break it out.
Somebody can't make that one, then maybe they could come on and come out and go, yeah, well, okay, yeah. Figure.
So yeah, figure out that schedule and then give him a call and see if he's available for those.
Oh, all those sheets need signed.
Okay.
We only signed one.
Oh, thanks.
You're welcome. How you doing? Yeah.
These go to Sarah or? do you-
Yeah. Yes, please. Did he finish that? That reupholstered couch bed thing, did they finish it?
So, there was a little marring on it and he came and looked at it. I'm not sure they fixed it, but he's gonna work that out with Carol. And they're gonna fix the big table. So I think that, we plan on the big table with, go in my, off the attic and the storage, file storage area and then, that table that's in there go down to the boiler top or, you know.
Okay,
mm,
perfect. I'm glad it's gonna get
Yeah.
used.
Well, cause they have reupholstered couch bed to 2071.
You might wanna talk to Carol, make sure she's good with it, but I think she is, and,
Yeah, this would have come from her office.
yeah, okay.
I just didn't know they were doing it.
It turned out good, yeah, it turned out, good.
So it's done?
Yeah,
Oh, so
it
it
was just a little marring, but I think that was, yeah, it was just something, it's an old, they did it for what, for an old couch, they did a great job.
I'll have to go look at it.
I'll go look at it. Is it
Yeah,
in the judge's chambers?
yes, the Judge Chamber.
What? What? What?
See first.
Okay. Oops, we're kind of behind a little bit. For our claims, there's a whole bunch of them.
Is the one. Could move to the next one and then do claims. Finish claims after.
Yeah, that's what I was thinking. So we're gonna go with the 26-27 cyber insurance application with Marsh McLennan of agency. Discussion, decision. And that's just that we've already decided we we're going to do that, we just need to sign off on it, is that correct?
Something you do every year.
Yeah.
It's a cyber
Yeah.
security insurance.
Was that the one they were gonna drop it from 11 to 5? Was that gonna be, they were gonna,
Yeah, it was somehow cheaper, I'm not sure.
Yeah.
Rate.
We went through it and,
Yeah.
yeah. Yeah,
You said correct.
Are they on right now?
yeah, so is this,
Yeah, I just need the motion to approve the application, right?
yeah.
I'll make a motion that we approve the application for
Cyber security insurance.
the cyber
Were the applicants,
insurance application with Marshall.
I'll second it. Any public comment? Things none, all in favor?
Aye.
Aye. Mr. Contact.
Rhodey Holman.
No,
But,
Or is it county contact?
oh,
who's the county
I
contact?
thought you meant too, is their insurance agent.
I can. I can,
Yeah.
Mon B?
yeah. I was the last time.
Yeah.
Thank you.
Okay, so. Task order number 27-07-4-31-119-0. Oh. 0, 0, to the master contract between the state of Montana Department of Public Health and Human Services in Granite County. Task order is regarding the immunization program. Discussion decision. From this can be docu-signed.
Yes.
I'll make a motion, we go ahead and accept it on your recognition.
I'll second that. Any public comment? Being none, all in favor?
Aye.
Aye. Motion carried and passed.
Was this what you were talking about, Brian, for the cow? The cow?
Yeah. That old one, that old bed thing up there. That's probably original,
Original courthouse.
the original judge in
Judges.
1913 probably had naps on it.
Okay. Now leave that one alone.
Okay, we've got a few minutes for this. Oops. Got about 5 minutes till our next agenda item. So Blaine, is that coroner's inquest private knowledge or public knowledge?
Public, yeah.
So who was the inquest? What was it?
It was the officer involved shooting, from, it was, February 2026. Yeah,
Down in
Court-
Knoxville.
yeah.
Oh.
Coroner's jury found no criminal liability by the officer. Suicide by law enforcement.
didn't think we had nothing. Let's see.
There's a certain amount that they have to call. For that inquest.
So, the jury needs to be either at 7 or 9, and so, and you can do alternate, we just did at 7. And but the pool was like, we're trying for 15, I'm not sure how many jurors we got there, it's right around.
Have we heard much on the Phillipsburg gamblers? Are they going pretty good, or have we had any updates or anything from them?
I know they've been going out.
They've been,
Well, I guess looking at their claims, so they just, when we're gonna talk to them, see how it's going.
Yeah.
Have a little John come in, maybe find out what.
Sure. All right, and
1 minute.
Hmm? Tell me to hurry up.
No, you don't have to hurry up. You can do that after the fact.
Yeah, we can start.
So we can, for next agenda item, update from Granite County Medical Center representatives and the Billings Clinic representatives discussion.
One.
Well, first, I will introduce myself, John Barber. I'm co-chair of the hospital board, along with David Wood, who I believe we have met before. I'd like to thank you for having us here, giving us the opportunity to give you a status update and review our future plans. I'd like to begin with Doris Gilbertson, our interim board member and interim CEO, to give an operational update. Then I'd like to follow up with the discussion about how Lisa worked with Billings Clinic, as well as a discussion about a recent meeting we had with Charlie Bremerton, the chairman of the DPHHS. So Doris, would you need to begin?
Thank you, John. My update is going to be from June 1st to today, June 15th. As you very well know, our utilization fluctuates over the course of a year. And so we have to deal with those fluctuations to the best of our ability. Our operational achievement since June 1, I believe, is phenomenal in terms of what we were able to accomplish with the support of all of the staff of Granite County Medical Center, as well as Billings Clinic. We have 2 new water heaters installed and paid for by the Medical Foundation. We have begun the reconstruction of a lab in order to accommodate a piece of equipment that was too large to get through the door, funded about funded by the H&R. And as you know, around the first week in June, our contract for imaging services was terminated. As a result of that, we have been looking at other ways in which to contract with a service for imaging. Fortunately, the Billings Clinic came to our rescue within a day of my contacting them, telling them about issues, and them agreeing to help us with our imaging process. The staff at both Billings Clinic and our facility were phenomenal in terms of what they accomplished with the radiology imaging process. As you know, we have been on divert because we do not have imaging services at the facility at this point in time. However, due to their due diligence of both the clinic and our staff, we will have services by tomorrow. We have to train a couple of our radiologists to work the system in Billings Clinic. There are going to probably be a few hiccups, but the thought is that the expertise and help we've had from both inside and the Billings Clinic, truly appreciate that. Our chronic care management program is developing and we're progressing towards a full program with start updates ongoing. This is a program to help individuals in the community that have chronic illnesses, and it's our way of serving them locally in their time of needs in a chronic condition. We're pursuing a HRSA grant, which has come into our knowledge base. We received grant money from the SHIP grant, about $13,000. Granite County Medical Center is now a registered apprentice sponsor for the state of Montana through the Department of Labor. What that means that we are an educational program that nurses, CNAs can advance while still working at their job. We currently have 2 CNAs that are working to become LPNs locally, and we have 1 LPN to become an RN. So these individuals are being trained, they're doing their education with most of the money provided by the state of Montana for our local people to come and work at our facilities in hopes that we can reduce traveling costs. So very proud of being able to have that designation. Let's see. In terms of utilization, we had 3 observation days from June 1 to June 15. We had 17 emergency room visits. We had 27 days of swing bed to the amount of $174,000 of possible income. We've had acute beds of 2 days to a tune of $63,700. We've had 7 x-rays, we've had 4 CT and 1 echocardiogram within 15-day spaces. We have very capable staff to be able to work all these elements within our facility, and it's amazing what they're able to do with guidance and support from yourselves as well as the community. So thank you very much.
So you had like 180,000 come in?
Well,
and
we
then,
will. But keep this in mind, that billing doesn't come tomorrow. It comes, we're gonna bill that amount. Will we get that amount? That's questionable, but it's gonna be down the road 1 to 2 months where we'll see the results.
And that's just swing bed, right? It was 174.
173,
Yeah,
right?
173.
Mhm.
So where you're saying you got them beds, so once you start that, it will be an average every month of that? Being you have swing beds, just, I'm not holding you to that price, but just, you're saying that,
Yeah, it's about $6,000 per day for,
okay, but I'm just saying
Income
that
from a
once
swing
you
bed.
start getting paid, then you'll actually, you're a month out from being paid, right?
yeah, month
So
or two
then
maybe.
monthly, it'll catch up, it's just like doing
Yeah.
starting a new job, you gotta wait 2 weeks.
Yep.
So every month you'll have that money coming in,
Well, until it's paid for,
no?
There's no guarantee on the swing
No,
bed pay.
yeah, I know,
Yeah,
I know,
yeah,
there's no guarantee, yeah,
But,
I'm just trying to figure out,
yeah, but this is comparison to last month with nothing.
I didn't say that.
Yeah, no, I am just saying
I'm
if
just
that's
trying
our
to figure out, people are
fluctuation.
asking and then
Okay.
you gotta,
Sorry
I'm
about
just
that.
trying to break it down to.
Okay,
Yeah, I'm not saying that,
okay.
I'm just
How-
trying to figure
How
out
can I
where you're
help you?
sitting and what your finance will, I mean, it's great, the people are awesome, I don't have a problem with people, but
Okay,
it all comes back to the money deal. That's the whole thing.
And
what
that's why-
everybody's-
yeah, I agree.
Everybody's worried about the money deal. They're not saying nothing about the people that work there.
Mhm. Okay, and John, can you step in with your report?
Billings Clinic has been tremendously successful over the past 25 years.
Can you speak up? Yes,
I'm sorry. Billings Clinic has been very successful in partnering with over 20 other critical access hospitals across the state and in northern Wyoming over the past 25 years. They've worked with other critical access hospitals that were in the same financial situation as us. And through their affiliate program, they've provided executive management, they've provided administrative services, they provided operational services, they provided medical services. And all this, with that support, those critical access hospitals have turned around and become successful.
What's their rate on getting it back up running in them?
I think every case is different. And it does take time. First, they go through an evaluation, and then they provide goals and support. And they've proven that they could do it. We've talked with them, we've had 2 meetings with them. And they've offered to provide us with an evaluation. And after that evaluation, that evaluation will result in short-term, mid-term, and long-term goals and solutions to alleviate how.
Do we have billing reps online?
Yes, we do.
Yes, we do.
Okay,
Yes, we do. And in a few moments, I'll introduce Jim Duncan from Billings Clinic, and he will give some further review. So we've just begun a process with them. It takes time. We've had two meetings, and they're over right now. That shows interest on their part. They're interested in working with us as much as we are interested in, obviously interested in working with them as well. As a result of the last meeting that we had with them, which was last Thursday, Jim Duncan from Billings Clinic introduced us to Charlie Bremerton. Charlie is the director of the DPHHS, Department of Public Health and Human Services. DPHHS has been tasked with dispersing federal funds that came out of the Big Beautiful Bill, approximately $360 million, I believe, of federal funds across the state to critical access hospitals just like us. And that support will go over the next 5 years.
so what you're saying, this is
This is in
really
This-
positive where it's coming in.
We believe it's
And-
very
okay.
positive, yes,
Okay,
yes, because, they've, identified us as a critical access hospital that they want to evaluate and review and potentially, supply support. So with that, I believe Jim, is on, and if we can unmute him, we can
okay, so which one?
jump in.
Can you hear me now? Do you want me to
Yes.
raise my hand here?
Hello, we can hear you.
You can hear me now?
Yes. Oh,
You can hear me, yes?
Yeah.
Okay, good. Well, good morning, everyone, and thank you for the opportunity to share a few comments. And I will be asking some of my colleagues to give some general overview as well. I guess what I'd like to say, there's a lot to what was just shared about the opportunity that exists for the future of your organization in Granite County. I'm going to focus initially on what John was just referencing in terms of the legislation that was passed last summer by the US Congress and signed by the President. The One Big Beautiful Bill Act has the Rural Health Transformation Program funding in it. That's $50 billion nationwide over the next 5 years, a total of $50 billion. Each state had to apply for these dollars, and the goal of these dollars is to help sustain rural health care across the nation. And the way it works is each state has to apply each of 5 years. Montana applied for year one and received $233 million. And that was the fourth largest amount in the entire country, which is good for us. What I should note is it's divided into multiple categories. It's not for building new buildings. There might be some construction that can happen or some remodeling. That's still being determined. There's some workforce initiatives. So the apprenticeship program that Doris mentioned earlier, that will get some dollars for support. And the way it's working is the state of Montana, the Department of Health and Human Services, is overseeing how this program will work. And they've been in the process of doing that. Right now, they're on the cusp of selecting a firm that will go into work with the critical access hospitals in Montana to identify needs for all of them. Some are at higher risk of sustainability issues, some are at lower risk. That particular procurement process is going on right now. Once they select a firm, we will then have the opportunity to apply to be part of that assessment. And what that does is, this is separate from what Billings Clinic does with our due diligence. The state will have a recognized firm with expertise to do an assessment, say, for example, of Granite County Medical Center. If we agree to participate with that assessment, your opportunity for funding from the Rural Health Transformation Program goes up substantially. So we're going to be recommending as part of this package that we sign up for their assessment. They will come in and do it. And then there's a governing board of this whole program that will then look at this information and determine who is going to get the dollars. You have your hand up, sir? Or
This is Scott. Yeah, how much is the assessment thing then to come in to see if you'll even take it on?
the assessment will not cost the hospitals any money. The assessment will be provided using the funds that the state has been awarded. So to get this Rural Health Transformation Program assessment will be no cost to the facility and no risk to the facility. And then if you do it, you're eligible to be in the pool for additional dollars. And you saw the slides that we sent. So we have a good, close working relationship with Director Brereton and DPHHS. We met with him last week and said, this is a time-sensitive matter to try to get some help for the hospital in Phillipsburg. So he took time to kind of go over some of these details and wanted you to share that. There's a lot of devil in the details about what's coming with this program, but I wanted you to also note the timeline. So March through July is selecting their vendor. July through August is contracting and kicking it off. September through November, that's when they start working with that first group of facilities. The state can't promise anything to us at this juncture, but we have made it very clear that we would hope they would prioritize Granite County Medical Center as one of their first ones. No promises, but we're pretty vocal about that. This hospital needs help, and we want to be there. We want to help you along the way. So I'd like to, we can come back and answer questions about this federal money. There's a lot of hope for that. There's no guarantees yet, but we're teeing it up very well, I think, to help. But I'd like to ask, if it's okay, I'd like to ask my colleague Nicole Hobbs just to touch a little bit also on what John mentioned about who we are and what we do and what we see with your situation. So Nicole, she's
Sure.
on the screen.
Can you
there.
guys hear me okay?
Yes.
Yeah. Okay, great. So I'm Nicole Hobbs. I'm the System Chief Regional Network Officer. So what that really means is I work collaboratively with Dr. Adam Smith, who's on as my physician dyad, to oversee all of our regional hospitals. So we have in our network 25 hospitals in total. 21 of those are critical access hospitals. And then 18 of those are through management and affiliation agreements, meaning we don't own those facilities. They are independent, locally governed, but we have contractual relationships to help support them. I think just to kind of level set from what Doris and John were sharing, this is what we do every day, is to support critical access hospitals in being financially sustainable. I'm a former independent critical access hospital CEO from down in Wyoming, was what I did prior to coming to Billings Clinic. I've been in a lot of critical access hospitals. No one is the same, but what I will share with you, just from our very limited kind of taking a look at the financials and meeting with the board, Granite County, unfortunately, is probably one of the most dire situations we've seen. Definitely one of the most dire situations we've seen in the state of Montana. I think you guys have an opportunity with RHTP, as well as when I look at just what's leaving your community for care in terms of inpatient volumes or folks seeking emergency room services elsewhere. There's also a huge opportunity to keep those patients in your community. And we've worked with sites to do just that. Harlowton, I had a similar conversation to this probably 6 years ago with their board. They had very limited funds. They were struggling. And today they have a brand new hospital. And so again, I think you guys have an opportunity. We can see how you can be successful, but it's not a flip the switch overnight change. It takes time. It takes expertise. As Doris talked about the financials, I was thinking through healthcare finance and healthcare math is so complex and hard to understand. For every dollar you get paid, you don't get a dollar back. And when you get any money back out of the dollar you build is a guessing game depending on like 15 different factors. And so it's a really challenging, again, we think we can help you guys, but we're also here to kind of listen and understand where the county commissioners are at, where the board is at, because RHTP funding, while it's dollars available, to Jim's point, and as you'll see on those slides, it's not available for a couple months. And so we want to understand really, and we've shared this with the board, where the relationship is, where you guys are headed, because the facility likely needs some funding support for several months until they receive some of that rural health transformation funds so that they can hire the expertise they need to do the hands-on work to get the ship headed in the right direction so they can start getting more dollars in the door and getting more patients there. So maybe I'll pause and happy to answer any questions.
Any questions?
Yeah,
Blaine?
this is Blaine Bradshaw, County Attorney. So you talked about, potential some financial support. What does that equate to?
I think ideally, just again, we have not done a full assessment, but if you want to stay an independent hospital, which is the model we most commonly support, as I've told the board, you'll need to look at how you have operational dollars for likely the next 3 to 6 months until you could access some of that RHTP funding.
There's a need for some additional expertise to help assess the financials, the payment structure, making sure we're taking advantage of all the opportunities. It's complex, and you don't have the rooms full of people that know how to bill Medicaid and get everything out of it that you can. There's a number of different scenarios, and the leadership needs to have those resources as we chart this new course of heading towards sustainability.
This is Blaine again. The medical center is in basically debt to the county, but the county commissioners have told the medical center to, if that's being that debt's been whittled down, then that's what the plan the commission like to see happen. It sounds like that's, from what Doris said, that's what's happening. So I don't know if the
What is the debt though, now?
So yeah, that's my understanding is it is gone down some. Is that your understanding?
What is it
Yeah.
now, today?
What is our total,
As of yesterday, it was approximately 1.4 million.
1.4?
Mhm.
Yes.
Oh, go ahead. Jen.
Oh, thanks, Blanche. Hi, everyone. Jen Walters here. I have a couple of questions, and sorry, I had to step away for just a minute in case I missed anything, but I just heard Blaine kind of ask, how much money are we talking about here to get the additional expertise needed? And I don't feel like I heard an answer to that question. What I heard was we're gonna have to spend more money to figure that out. So does anyone actually have an answer to that question?
They kind of said they wouldn't know nothing for a few months till they assessed it, the way I understood the answer.
So who's
Yeah.
assessing it?
Yeah.
Maybe Nicole, if you could jump on, but we Billings Clinic have had just 2 meetings, lots of good conversations, but we haven't gone in and done our formal due diligence work, and we need to do parallel to the rural health transformation. Keep that in a separate bucket. There's going to be an assessment from them as well, but that's a couple months out. If there are some things we could do in the meantime where we could get some assessing done now that we just do, Nicole, do you want to explain how that works? Because we don't have an answer to what the immediate short-term need is until we roll up our sleeves and look deeper at the needs. Nicole?
Right. So as I said, most of the time when we get involved, it's much earlier on in the process. We've not come to a facility that is in debt almost 1.5 million to the county, right? And so the first step for us in talking to the board would really be to help the board find a longer term interim CEO who has that really solid financial turnaround expertise. And those folks are rare. We do have some of them that we're familiar with and are available, but they need to come in and unturn every stone to say, what are all the challenges? Where do we need to go? And to help with that financial forecast that I think you guys are asking for, to say, okay, what does our losses look like? Or maybe you have a profit for the next several months so that you could come to the county and say, here's our cash flow projections. We have not done that level of expertise. If we were to move forward with truly looking at an affiliation and a longer term relationship, which we're open to, I'd have a whole team come and spend many days on site going through the financials, spending time with the nursing staff. We do a very comprehensive assessment, again, to understand where the challenges are and maybe how we could help support that. That assessment, as we shared with the board, it comes at no cost because it's really just us trying to understand what's going on. But from just a true healthcare operations, you today, the facility needs some really tenured guidance on someone who understands financial turnarounds to come in and start to make progress and have expertise in what decisions need to be made that are data informed, so that you don't, unfortunately, one of the challenges with healthcare is you can easily, for example, in a critical access hospital, you can only cut expenses so far before it the money you get paid from Medicare, because you're cost-based reimbursed. So it's a delicate balance to try to make sure that you're making the right decisions, cutting expenses or managing them appropriately, but not impacting your reimbursement at the same time.
Okay. Yeah, sorry, I appreciate that explanation. It's good to know that there's currently not a huge cost associated with, the assistance, but it still sounds like everyone in the room is asking for, financial support from the commissioners to make it through the next few months, just like they have been, but no one is still giving us that number. I think at one of the last meetings, Doris was requesting $150,000 for some unexpected expenses, like she mentioned, the 2 water heaters, and I understand the foundation replaced those, but she had also mentioned a pretty bad roof leak. Is the roof still leaking and, negatively impacting the nurses station and whatever else was going on with that?
That has been corrected.
And did the foundation also pay for that?
It was money that we paid for through the facility.
Okay, I thought when you requested it last time, you said the facility didn't have money to pay it, so that's why I'm asking.
Well, we didn't have money to pay it, but we couldn't afford a flood down to the roof into our nursing department.
So how was it paid?
With money that was provided to the county.
Okay, I'm not clear on that, but okay. Can you tell me, you mentioned a piece of lab equipment was recently replaced. What I'm understanding that wasn't just a small piece of equipment. What was that and how much was it?
It was of no cost to us.
I know you said that H&R paid for it. I'd still like to know what it was and how much it was.
Okay, H&R paid for the reconstruction to get the piece of lab equipment through the door. And that basically was $25,000.
Okay, so H&R paid for the reconstruction, but who paid for the equipment and how much was the piece of equipment?
Okay, it's a contract piece of equipment. It was given to us as a way of trying to introduce it to other facilities around the state as something that they need to improve their lab.
Yes.
Yeah. And so, yeah, we were a test.
The company Siemens is
Letting you use
offering it to us, promoting it exactly so that they could get additional revenue from other facilities.
Make sure it works and then, and then they can sell it.
Yeah, they
Kind of beta test, if you will. Yeah,
A lot of them do it.
right.
A lot of companies do that.
Yeah, exactly.
What's your monthly running? What's it cost to run that on everything?
The entire,
Yeah, just by the end of the month, what do you, everything paid on? It's trying to figure
Several
what,
hundred thousand,
several about 100,
over several, yeah.
So if, I'm looking at the cash report for the, hospital district, and the beginning balance, for June was in a negative 1.5. They've so far received 983,481 and dispersed 674, 734. So right now they're down 1.2 negative. So they are getting cash in there. So if
So
we can keep.
Blanche,
Go ahead, sorry.
I was gonna ask with that, just because I've been trying to keep notes from the meetings and track numbers, so clearly they definitely have made progress, because we've talked about, 900 something thousand dollars being recovered, but there's still, 1.4 in the red. But so is the hospital still considering taking that, or asking for that $975,000 intercap loan?
The caveat on that was if the commission were, willing to co-sign the loan. And and I believe it was decided that, you would not, so we cannot move forward with that loan.
Okay.
Yeah, and you were gonna go see if they would go ahead and lend it without our co-signing it, weren't you?
And they need the support of the county.
Right.
they want for
They
it.
need the support of the county.
Oh,
Needs to be co-signed.
Right.
Yeah.
Well, this is Andy, and I think the Billings Clinic is the only option to save, and I think the board is of that opinion too.
Yes.
And so I think, but I also think, they've got to be showing that they're whittling down that debt as well. And so I think that's my advice to the county commission.
Well, 1.5 down to 1.2 is what it is.
Yeah. So they're making,
that's why I was asking what it costs to run it and what's coming in with them swing beds at 100 and, you're gaining a few dollars on
As long as you have them still coming.
that's what I'm trying to figure out, the
Yeah.
monthly income compared to what's going out. So we're sitting about a balance,
Right.
break even.
and what
Yeah.
Doris has said, it sounds like there's revenues coming in, so that's positive. And so that.
Well,
that is positive,
utilization
yeah.
is increasing, and therefore revenue is increasing, so that's what we have to continue.
I think we have to go for it. I think if Billings is willing to, and if we can, if they're good talkers and they can get those grants for us, yeah, I think I'm for it.
Well, we thank you.
It's because that's gonna, when we get bailed out, then we're gonna have to watch it. We've been going along for about, what, a year now?
Right.
And just going along. If we could push it for a few more months to get guarantees that it's gonna come back. And then you guys wanted to you're gonna put another levy on, correct?
Yes.
In November?
Yes.
For how much?
I don't know if that's been decided yet.
We haven't decided yet. We haven't planned that yet.
I think having Billings Clinic folks on board is the way to go, and that ultimate decision on that is the hospital district board, but at least it's assurances to the county commission that they're moving forward and have a plan. And I think the commission would like to see when they do that assessment, what the plan is.
Of course, yes.
Did you have a question?
Hi, I just had a comment.
State your name, please.
Maureen Jost, I am also on the Granite County Hospital Board. And I would just like to say as a resident and also board member that up until this time, I know that the hospital has struggled on its own, but we have help out there from a very successful company, Billings Clinic. They've proven what they can do for other hospitals. This is a lifeline that we have not had before. And the fact that the state has this money coming, and in another 2 months when we go for that, new monies, the levy in November, we will have solid information at that point to give to the people of Granite County about where that money is coming from and how much it can do for this hospital. So I appreciate any support that you guys can give for just, 4 to 6 months to get us over this hump, because there is money and there is help right at our door. Thank you.
Any other comments? Oh, go ahead, Duncan.
Oh, thank you. I just want to say I've been with the organization for over 30 years. And just for clarification purposes, we're a Montana-based organization. We're not for profit. We're community governed. And at the core of our organization, which is very unique in healthcare, we have a passion for keeping care local and sustaining healthcare in local communities. That's really what drives us. Having said that, this is not easy work for anybody that's on this, whether it's in Harleton or Phillipsburg or Scobie. And in my invitation to all of you, from the county commissioners to the community members, this is a time we need everyone to roll up their sleeves and help us sustain this important asset that this community has. Because if we lose it, the economic impact, if you're a rancher or a farmer and you have an accident, you can't go to the ER. There's a lot of passion from us. This isn't in our backyard. We don't know a lot about your organization. We're learning about it, but we're not here to put a dot on our map. We're here to try to sustain rural healthcare. And we still have to do some work to see that we can deliver what your community needs. And this is not going to be easy work. And there's a lot of turnaround that has to happen. But thankfully, you've got board members, people at the organization that are working hard. I think anything you can do to help inspire and engage the community to save and help this organization thrive is what we all need to be doing. We'll tell you what we've learned in other places and try to have you take some of that and use it. And we'll be there by your side, but we still have to do a lot of our own assessment to see what we can do as quickly as possible in partnership also with the state and their opportunity that's forthcoming. So thank you for that opportunity, and we look forward to having the chance to meet with you and talk in person. We were there last week in person and learned a lot. So there's more to come. It's not a light switch, and we don't have the magic wand, but we have some pretty good talent and people who care about doing this for communities.
So what you're saying, this is Blanche, is that you're committing yourself to Granite County and to help us, and we need to commit. And as the county government to possibly could we still float what's going on as long as there's revenue coming in?
That's
I think this is what you're saying, right? And we need.
I might clarify for Jim, if I may. So we are committed to rural healthcare in the state. That has been a core component of our board's commitment to Montana and the residents of Montana. We still need to take this to our own governing board if we were to move forward with a formal agreement. And so again, as I shared, we really wanted to hear where the county commissioners were at in terms of working, because our true belief is you can't be an independent, locally governed hospital organization if the community and your county commissioners don't support it, right? And so we heard that today. I feel comfortable taking it to our board and asking for us to at least move forward with an assessment, and then also we are committed to partnering with the hospital board to help them find a longer term interim CEO who has that subject matter expertise in financial turnarounds at critical access hospitals to start moving them even faster in the right direction.
Yeah, I apologize. I was just trying to give a framework. This is a tough one. We've got work to do, and we have to work with all of you to know what's under all the stones. And this is going to be work, but it's the right work. And even if we didn't affiliate, we'll still use our contacts to help you. But we know a lot of people that can help. But we need you to hear the honest assessment that this is not a quick fix.
Right, right.
If I may add, even without a formal agreement, Billings Clinic has been so helpful to us. Doris just mentioned the radiology issue. You know, Jim Duncan introduced us to the director of DPHHS. You know, we wouldn't have been able to do that.
Right.
You know, so they've been so helpful even without, you know, an agreement. So, you know,
Scott?
this all looks very positive to us.
Well, Blaine, what's your advice?
But I think Billings Clinics has the assurances from you that they, at least they can go back and that's the only option going forward, or shutting the doors. It's using Billings Clinics or shutting the doors. I think they're the only two options now.
Right. So this is just one comment that I'd like to make, and I want to say this because of the fact that this hospital's been going forever and ever and ever, and it's been on voted levies for a long time, but it's a community and the people need it. And we know that the levy did fail the last time, but I think the levy was kind of gone about maybe, okay, you can't expect the county to support the hospital district, but the county has always been willing to help, especially when we have residents up there. I think it sounds very positive to me that these people are giving us hope. And I think we've got to go after that hope, if nothing else. Because we've let it float now for over a year and we're not destitute yet. But if this is going to be something, and they sound very positive, I am all for the county following along and trying to keep it afloat until we can figure out the revenue and get the grants. Okay. Go ahead.
So my name's Adam Smith. I'm a physician, work with the Billings Logan team. But, you know, as you talk about those two options, you know, rolling up sleeves, all working together, or shutting the doors, you know, as a clinician, I've been to Phillipsburg many times. It was one of the first places I took my family when we moved to Montana 19 years ago. You know, I cannot imagine not having a healthcare resource in your community, just from a jobs perspective, a safety. You know, when you've got an accident, you know, time matters. When someone has a stroke or a heart attack, time matters. And so I just would say, you know, thank you for, again, jumping in and working together with us. You know, we have some expertise in this area, you know, whether a Highline Hospital or Eastern Montana, you know, but we're really here because we genuinely want to help. When you lose a resource in a community, it's devastating for that community, and you're a community that's growing. You know, we see huge opportunity down the road, but it will take some time. You know, I love what Jim's saying. It's not a switch that we can flip and it will be profitable tomorrow. But I do think, you know, working again together, there's huge opportunities for the county, for the community, for the residents that live there. Thank you.
What we need to do.
Maybe call for any other public comment, probably.
Is there any other public comment? Scott?
Just at a pause here for just thinking. I'm for it. If they can step up and help you get out of this mess, you know, I just, it's scary.
It is.
And if they can do it, great, but what happens if they can't? Then what? Do we just prolong some more, or what are we gonna do?
So Blaine
It's part of it.
and Scott, my comment is because of the fact they've got these programs that they're looking at and it's a
Right.
positive thing. I think the county has to go forward and try, if anything else, if 6 months comes along and it doesn't work, then let it go. But right now, we have an opportunity to get these grants and to keep them afloat. And if it goes down, it goes down. There isn't anything we can do about it. That's my opinion.
Sounds like they're asking for 3 to 6 months,
Yeah.
was that time frame correct?
Exactly.
And what I'm saying, 3 to 6 months after we've already given a year,
Right.
what's 3 to 6 months more?
That's why I was asking what their payout was and what they kind of just the base, what's coming in, shows about 20 different coming in the flat. You know, after you get the swing beds and just trying to break it down and see.
Okay.
Well, I think
You
if
want-
it's put out there that there is hope, people are going to feel better.
Right.
Because-
Mistakes have been made in the
Putting it out there and saying there is hope and I know the levy the levy failed, but I think that they were upset and they felt that things weren't going and you're turning it around is what I'm seeing and what they seem to be saying is what I'm saying.
We're looking to the future. We have opportunities and we're
Yeah.
looking to the future.
Yeah.
And that's.
More so than you had 2-3 months ago.
Exactly, exactly.
You feel positive now, or more so than you did 2-3 months ago.
Absolutely.
I'm
Right.
pushing now.
I'm not gonna try to sell it. It's not that I'm against it, it's just, there's so much out there that's not being answered, and it makes you kind of skeptic, because we've been told something and stuff never happened, then all of a sudden we're back.
But as Commissioner Cooler just said, in three months or so, we will know more and we'll have more of those answers.
And Scott is very, very conservative, where I'm more positive and I feel good about this, and
Well,
so that's why
it's a good
I'm trying
balance.
to.
And I'm not trying to be negative on it. There's so much that I get asked that needs to be asked, and people are scared to ask, because they're
Understood.
worried that what's the conflict coming back on them for asking. I mean, it is what it is.
Okay, we've got some more comments here.
Yeah.
Go ahead, Jen.
Yeah, I wanted to make you aware, just be sure you look at that timeline on the slide we gave you from Montana Department of Health and Human Services. 3 months is on the early side of that. I'm glad you said 3 to 6 months. This is a big ship to turn around. And I like to be transparent. From what we're seeing, we've got some heavy lifting, we meaning all of us, between now and the end of 6 months. A 3-month time frame isn't going to have enough time for the state's potential funding, which we hope, and we'll be pursuing that. And we have to do due diligence. But there is this funding from RHTP, the Rural Health Transformation Program, is designed exactly for at-risk rural healthcare. We fit that bill with Granite County Medical Center. And have they said, yes, we'll get money? No, but we're pretty persistent people to put money where it should be going to sustain rural healthcare. So I know we're on the edge of needing immediate reaction. It's going to be a little bit hard for a while, but there's some hope at the end of the tunnel on this. And I like what you said, Commissioner, about, what's the alternative? We don't want the alternative for a community in our state to not have a hospital or some kind of, for sure healthcare. So be patient and be involved, ask questions, and come forward with ideas, and we will welcome them.
Jen, did you have another comment?
Thanks, Blanche. I did just two things really quickly. Since I keep hearing mention of, needing someone in place that really, understands how the hospital is working and what needs to be done to change it. So has the search already been underway for a new permanent CEO? Or if the hospital ends up partnering with Billings Clinic, is Billings Clinic do they have someone that they're planning on providing as a CEO, or like what is the plan for a CEO in all these upcoming months where we're talking about needing to figure things out?
Joanne can maybe jump in and just share what's been asked of us by the board and then how our model works. So the board initially reached out asking if we knew of, I think their prior board chair had informed us that they were looking for a permanent CEO. Our recommendation back to the board was actually to pause on hiring a permanent CEO because I don't think that is the right decision based on our very initial assessment. What Granite County needs is a really strong interim CEO who can make hard decisions and get the facility turned around. And then when it is more stable, Billings Clinic's model is to partner with the local board to hire a CEO who would be, if we were affiliated, a Billings Clinic employee and report jointly to the local governing board as well as Billings Clinic. But right now, what the facility needs is that interim. There's a time you want an interim CEO because, again, they can make the hard decisions. They're skilled in turnarounds. But those type of people aren't typically the person you want there for the next 10 years, if that makes sense.
Okay, so is that person Doris? Is Doris staying in that position, or is that what we're saying? Doris is staying in that position over the next several months while we figure this out?
I can answer that question, and the answer is no. I will not be staying for the next 3 to 6 months. I am a volunteer CEO, and I believe going with the Billings Clinic and their recommendation of an interim CEO, starting as soon as possible, is what we need to do.
Okay, so maybe I didn't phrase my question right. Whether it's an interim CEO or a permanent CEO, is that search already underway?
We have a couple candidates identified as potential interim CEOs. We typically have a list, but we are not today searching for any permanent CEO, but we have reached out to a couple folks to understand if they would be available for an interim opportunity.
Okay. And just my last comment was, I mean, again, I think it's been reiterated over and over repeatedly for the last several months that people don't want to lose, the hospital as a resource here in town or for the county. I mean, like Scott said, it's definitely a concern, and I would just comment, like I mentioned in the last meeting, especially with the mill levy. So someone really needs to be out in the community talking to people about progress or potential funds, possible funds, whatever it is, because the community doesn't want the hospital to close, but the community also has a little bit of just an overall negative feeling about them being able to recover and move forward, and taxpayers are just really tired of bearing the brunt of a huge chunk of the budget. So we saw the canvas for the mill levy and the different areas that really were not in support of it. So I hope there's also a plan in place to really market to those areas and talk to those communities and reach out to those people so that they understand the facilities are not just the one here in Phillipsburg, but the one in Drummond, because the voters in Drummond didn't really seem to care much. The ones that showed out to vote all voted it down. So maybe people just really don't understand that it's gonna close if someone can't turn things around.
Thank you. Blaine, you have a comment?
I agree with Jen. I think she's right on the, that PR campaign and, it can't be, I mean, it's not a political campaign for the levy, but it's a PR campaign to get the word out of what's going on. But
So what do we do now going forward? Is there a motion that we have to make or
I don't think so. I think they just wanted, to know that you're gonna.
that we are in
Yeah.
support?
Yeah, you could do a motion to say you're in support of building funding. I don't know that. You said it.
Scott,
I just move ahead and see what's gonna happen.
so willing to move ahead,
Well, I don't think we have no choice.
Well,
I think
true.
we're at the point,
okay?
like they said, 3 months, 6 months, whatever, but I don't want to
Okay.
keep this just
Well,
dragging out.
it's gonna happen, it's either gonna be good or it's gonna be
Well, I
bad.
know, I just said.
So-
But my opinion
Right?
is I just don't wanna keep coming out and we have somebody else coming in with another idea and this shit just keeps going. Forgive my mouth, but it just keeps going on and on and on and we'll never get to the end. We
Well,
gotta-
comment,
Debbie Robinson, Public Health. I will just say the Rural Health Transformation Grant, Public Health has really been pushed to sign up in that slot. I feel like Granite County and our hospital is on the top. I mean, I've been pushed to
How
push
much
the
is that grant?
hospital. It's millions of dollars. And that's just phase one. There's I think 5 phases to it. So just as a peace of mind, know that Granite County is hitting the top of, we are in an emergent state.
Being the state of Montana is recognizing.
Yes, yes, very much so. So I'm pretty sure that grant will come to our hospital.
okay, you made a motion to support, I will second it. We've had our public comment right now, all in favor, what,
Oh, I didn't make more, I just said I thought we better move on.
I thought-
didn't know we had-
make a motion
He said we
to,
didn't have to make. a motion.
I think you both, stated it clearly, but
Okay.
if you.
Yeah, let's just stay at that.
okay, okay, anyway, thank you very much. We are comfortable with going forward. And, we, thank you so much for joining us. And, we're showing our support right now.
Thank you.
Thank you so much. Appreciate it.
Thank you.
Thank you.
Yeah, have a good day.
Yeah. No, I know. I know.
Hey, Steve. Come on up. Yeah, we're waiting behind now. Look up here.
Paul gonna be.
Yeah.
No, they've been running late. I'll leave it because you came in.
Yeah, sure.
Hey, how are you?
You sit up here?
Okay, sit up here.
Hey, I haven't done an interview since I was first here.
We're gonna go on for interviews.
Yeah, you want it, this is,
He wants it.
closed, right?
Yes.
Okay, we have finished our interviews for foreman positions. We had, Paul was on the phone with us during the interviews and we have made our decision and the 2 candidates will be getting a letter of whether or not they would like to that position and it will start immediately. With that, is there any new business or any business that we need to discuss before we adjourn? We are adjourned.